Unit 3, Drug Therapy and Dosage Calculations. Here are your objectives, and these are your reading assignments. When we're talking about drug therapy or medication, it is very important to consider consumer awareness, especially with social media and definitely media in general, the internet, and the direct-to-consumer advertising on drug sales and prescriptions. So you will notice that some patients are now just going to the doctor and saying, hey, I saw this on social media, I want to be on this medication. And so we need to realize that now it's good and bad at the same time because patients are now more informed, but there are times that because of social media or media in general, because there's so much information, patients in general, they may not know which are appropriate for them. They may think that just because so and so said it on TV or on Instagram or whatnot, that they think that's going to be an appropriate medication for them. So we have to be aware of the influence of media to our patient. So again, there's a benefit, but also a disadvantage to just having a lot of information out there. Anyway, let's talk about over-the-counter drugs. So over-the-counter drugs are medication that really don't need prescription. They are medications that patients or people in general can actually just purchase at their local drugstore. So these are medications that they can get outpatient. Again, no order or prescription is required. And that being said, though, even if let's say it's an over-the-counter medication that the patient is taking at home, if they end up being admitted to a facility or a hospital, because now they're admitted in the hospital, that medication, for them to continue taking it, they have to now get a doctor's order for it. And that's just for safety reasons and just making sure also that it's not causing any interaction or problem with the medications that they're going to be on while in the hospital. So benefits of over-the-counter medications. So generally speaking, these medications have a lower risk of being abused, and in general, they're quite safe to use for the general public. This doesn't mean that they won't have any side effects. Like I said before, all medications, regardless of how safe they are, they will likely have a side effect. I mean, some patients may experience different side effects compared to others, but generally speaking, all medications have side effects. Anyway, going back to over-the-counter medication, some benefits of it is just being readily available, that they can just purchase over-the-counter at their local drugstore. In addition, generally speaking, these medications are lower in cost, so they're more affordable for people. Potential problems for over-the-counter medication. Because they're readily available, anyone can just grab it and start taking it. The problem here is sometimes patients lack the necessary knowledge to make sure that they're taking it appropriately. Some patients may not even read the labels on how much to take, when to take, and so on. So that can cause some problems, right, for the patient. So potential problems would be patient's knowledge or lack of knowledge about taking the medication appropriately. And these patients will basically choose a medication based on what they know or they think is best for them, even if, let's say, it may not be appropriate for them. An example of that would be maybe ibuprofen. So most people take ibuprofen. What if it's a patient that has renal problems? Unfortunately, ibuprofen can be very hard on the kidneys. But if a patient does not know that and they're like, well, I have a headache, I need something for my headache, and they start taking it, right? What's going to happen to their kidney function? So that's really the danger to having over-the-counter medication. It's good, it's convenient, it has its benefits, but also it may cause some problems for certain people. Also, self-medication, right? So when patients start taking a medication on their own without prescription, without a provider that's actually managing their care and making sure that everything is, gonna work well together, then we may encounter drug-to-drug interactions, even nutrition-to-drug interaction, or maybe supplement to drug interaction. So again, that can cause a problem for the patient. It may cause their prescription medications effect to go down, or contrary, it may actually increase the effect and cause some adverse effects on the patient. And Even though the risk for abuse is low for over-the-counter drugs, these medications actually can be abused as well. So there's a risk for overuse and abuse. So it doesn't completely eliminate the risk for being overused or abused, because as you may probably have heard it before, some patients or some people, they may even just take those medications to maybe hurt themselves, right? Example of medications that are considered over the counter are your Tylenol, which is acetaminophen, ibuprofen, aspirin, diphenhydramine, or Benadryl. Alternative therapies or herbal medicine. So alternative therapies are basically herbal medications. This can also include chiropractic, acupuncture therapy, massage, reflexology, and any other therapies that are traditionally not emphasized in Western medical schools. So let's focus on the herbal medications, or they're also known as herbal supplements or supplements in general. So there are advantages of having herbal supplements or herbal medicines available. So advantages include they're readily available, against very similar to your over-the-counter medication. Much of these herbal medications or supplements are available over-the-counter in your local drug or supplement store. And the good thing is they also come, generally speaking, they come from nature. So these medications or these supplements, they're still considered drugs. It's just that they're a different type of drugs. They're considered herbal medicine or supplements. So anyway, these are often considered natural, and these are very useful. Well, certain ones are very useful for preventative treatment or preventative purposes. In general, they may consider it as a lower cost, especially comparing it to some of the brand name medications. That said, especially looking at our economy now, even herbal medications and supplements are actually quite expensive. Like one bottle can probably cost a patient $30 to $50, while if they actually take an actual prescribed medication, if it's covered by their insurance, they may end up just paying $7 for a bottle. So again, it just depends on what supplement it is and why are they using that medication. But sometimes it's lower cost. Nowadays, it's likely up there still when it comes to the cost of medication. Disadvantages. So unfortunately, supplements or herbal medications or herbal supplements are not regulated. So they're not regulated by the FDA. So they may have, random active chemicals or ingredients. And again, if a company is selling supplements, they don't have to prove that, that's a treatment for something. So some medications may be known for, let's say, for weight loss. While in fact, FDA hasn't really approved that medication for weight loss. So just be very careful with that. And most of the time, they're not regulated. There are some really good companies that actually get a third party to actually evaluate and analyze the content of their supplements. Meanwhile, you also have companies that basically lie about it. They put whatever on the label, and when you actually test those drugs or those supplements, there's not even an ounce of active ingredient, or if there is, it's very little to really have any effect on a patient. And so then you don't have any consistency when it comes to the strength and the effect of the supplement. Another disadvantage of that is, again, similar to your over-the-counter self-medication, and can cause drug-to-drug interaction, drug-to-nutrition interaction, or drug-to-supplement interaction. Examples of herbal medications or herbal supplements include the St. John wort, black cohosh, ginkgo, red yeast rice, and saw palmetto. So these supplements are used for various reasons. The most common reason for St. John's wort can be used for mood or depression, black cohosh for menopausal symptoms, ginkgo for memory and alertness, red yeast rice is used for cholesterol, and saw palmetto is for prostate health. When we're talking about drugs, there may be instances wherein you may hear somebody talking about medications that are given off-label. So what is off-label use for a medication. So when a medication is used off-label, that happens when medications are used for non-FDA approved indications. So let's say it's a blood pressure medication, but they notice that it helps with anxiety. So if the FDA approved that medication for blood pressure and then a physician starts prescribing the medication for anxiety, that use is considered off-label. Again, the FDA did not approve the use of the drug for that purpose, even though it's generally FDA approved. Anyhow, it can usually, when something like that happens, they will go through the process. They're gonna do some clinical trials and whatnot. And most of those drugs, especially if they see the benefits of it, from being administered off-label, they can eventually become FDA approved. When we're giving medications and when we're educating our patients when it comes to medications, medication compliance, it is very important to consider the cost of healthcare and the importance of patient teaching. So let's talk about the cost of healthcare. As you may be aware, everything nowadays is so expensive. And many of our patients, especially in Kern County, many of our patient populations may not have insurance, or if they do, sometimes their coverage may not be sufficient to cover for all their medications. So if you see that a patient is maybe not being compliant, maybe their blood pressure is not under control and you're wondering why, sometimes it's because they're unable to buy those medications, or if they are able to buy those medications, they can't buy them consistently because of the cost, because it's not covered by their insurance. So what happens is you may find some patients that are just taking half the dose just so they have enough supply to last them for 2 months rather than a month. And so again, we have to consider healthcare costs. And sometimes what I do for my patients, and you guys can do it too, there are going to be some patients who are going to be upfront with you and say, hey, I can't afford this drug or medication. There are definitely if possible, we can collaborate with the provider, and maybe they can prescribe an alternative medication that's not as expensive. Generally speaking, generic is cheaper, but there are some patients who react better, have better effects when they're using the brand name. So that's, something that we have to kind of think about as well. But there are some coupons. I know GoodRx is pretty good at, providing some medications that are more cost effective compared to other places. So that would be something that we can probably do for our patient. And really, if we run out of alternatives, referring them to social services, case management, and just to make sure that they're able to follow the regimen or the plan for them, so that they can continue to hopefully heal and continue to be healthier down the road, even if we're not there caring for them in the hospital or a facility setting. Importance of patient teaching. One of the major reasons why patients are not compliant is because they lack the knowledge to actually understand why is it important to take this medication. So for all the medications that you're giving your patient, you have to really educate them. It doesn't need to be so scientific that they don't understand it. It needs to be just enough so they can have an idea of what medications they're on, why they are taking it, and the potential side effects. It is very important for them to understand how the medication will affect them, or not taking the medication will affect them, because again, we want to make sure that they stay healthy so we can prevent readmission or potential complication from whatever disease they have. So again, patient education is so important, especially knowing that our patients are not going to stay with us forever, right? At one point, we have to discharge them and they have to take care of themselves. So they have to have the sufficient knowledge and skill to actually take the medication on their own when they're at home. Or obviously, if they're unable to do so, hopefully we can educate a caregiver, a family member. And make sure you're evaluating, right? When you're teaching your patient, you need to make sure you're evaluating their knowledge. It's not enough to just teach them, right? You need to kind of verify, did they really understand what you told them? Are they able to verbalize what you just said? So make sure you check that, and that way, hopefully we can prevent the patients from coming back because of the same reason, just because they were not compliant with their medications. All right, so this is something that I have to cover just because it's mandated, it's part of your curriculum. But in all honesty, it is very rare that we have to deal with it. Just kind of be familiar with it. So what we're going to talk about next is bioterrorism. So bioterrorism involves the deliberate release of bioweapons to cause death or diseases in humans, animals, or plants. So they're biological weapons. They may be developed or used as part of a government policy in biological warfare or by terrorist groups or criminals. So examples of this, so I don't know if for some of you, if you're old enough to remember anthrax, remember there was a year wherein everyone was scared to check their packages because apparently, they were being infected with anthrax. Another one is brucellosis and tularemia. And so those are examples of bioterrorism that had happened in the past. And so just know that it can happen. Now, how often is it going to happen, especially in Kern County? It is not likely. But anyhow, so if it happens, this is our role as healthcare workers. So hopefully we are able to identify the attack, and kind of, especially if you're looking at the trends, if it's something so unusual, then if you see something, you may not be sure about it, and that's okay. The most important thing is identifying that there's something wrong and that you have to report it. And then if appropriate, right, start interventions. And again, if we don't know the interventions, definitely go up the chain of command. And then definitely don't start panicking right away, especially if you're in the clinical setting. What you don't want your patients to see is you're panicking, right? Then they're going to start panicking as well. So definitely you want to minimize the panic. Stay calm, inform your patients, educate the public of what you know. Don't make up things. If you don't know it, just don't start talking about things that you're unsure of, but at least educate them on what you know, or at least what are the things that they can do on their end, and hopefully we can prevent mass casualties. Next, we're going to talk about drug or substance abuse. So drug or substance abuse is a maladaptive pattern of behavior marked by the use of chemical agents. The patient does not adapt well under the influence of the substance. So examples would be controlled substances, substances that can be abused, like I talked about earlier, are over-the-counter medications, prescription drugs, and definitely we have to know the difference between dependence versus addiction. So dependence is a physiological or psychological need for a drug. But generally speaking, in order to differentiate between dependence versus addiction, dependence is more of the physical dependence. So physical dependence is the physiologic need for a drug to avoid physical withdrawal symptoms. So example, a patient, right, may not want to take the medication anymore because maybe they're feeling better. They're no longer in pain. So let's say they're on hydrocodone and the patient decides to taper or stop taking the medication. And as soon as they stop the medication, they start experiencing withdrawal symptoms that can include tachycardia, restlessness, panic, feeling hot and cold, and so on. So there's different types of symptoms of withdrawal. So anyway, so then what happens is because they experience physical symptoms whenever they stop the medication, they have to go back to the medication again. So that's physical dependence. Addiction, on the other hand, is also known as psychological dependence. So in this case, this is the obsessive desire for the euphoric effects of a drug. So the difference is, an example of this one would be a patient who is taking, let's say, oxycodone, even though they don't need the medication anymore, but they just want to feel good or feel the high feeling of being on that medication. So that's the difference between physical dependence and addiction. So know that they're different, right? Not because they're physically dependent that they are addicted, or vice versa. Protecting the environment. As nurses, it is also our duty to make sure that we are disposing the medications appropriately because we want to protect the environment. So that includes, when administering the medication, if we have to waste a medication, we need to make sure that we're not just basically squirting it in the sink, right, and letting it drain. No, we need to make sure that we throw it appropriately. So there are appropriate bins in the hospital. Definitely follow your hospital policies, but most hospitals will have a blue bin where you can actually dispose of the regular medications. At times there may be the yellow bin that may be used to dispose of chemotherapeutic or more toxic agents. So again, follow your hospital, follow the labels if there's specific instructions on how to handle and dispose of the medication. Medication administration, we've talked about this. Know the 8 rights of medication administration. So it's the right patient, right drug, right dose, right route, right time and frequency, right documentation, right reason, and right response. So routes of medication administration. So we can give medication in many different ways. So enteral, parenteral, and topical. So enteral medication, there are advantages and disadvantages of administering medications using certain routes. So enteral medications, these are the oral medications or PO medications or any medication that goes through the GI tract. So it's called enteral medications. So again, these medications go through a gastric tube. Now, parenteral medications, so these medications do not go through the GI system. Examples of medications are your intravenous, intramuscular, and subcutaneous. So the fastest acting medications, so the medications that will likely have stronger effect on the patient and will act faster, would be your injectables or medications that we're administering parenterally. So the fastest action would be through an IV and then followed by the other injectables. Topical, on the other hand, would be a mode of administration of medication wherein the medication is delivered directly to the affected area. So it's more of a local thing. So typically, these are antibiotic ointments, creams, transdermal patches. Sometimes rectal route can be considered topical. And then inhalation. Inhalation is because we are actually administering the medication directly in the lung tissue. So that can still be considered topical. A term that you may hear often when it comes to medication is first pass effect. So what is first pass effect? First pass effect is the initial metabolism in the liver of a drug absorbed from the GI tract before the drug reaches systemic circulation through the bloodstream. So this causes a reduction in bioavailability or the extent of drug absorption. So first pass route. So again, first pass route, so an easy way to remember is that most drugs that will go through the GI tract, right, will go through that first pass effect. So example, hepatic, arterial, oral, portal venous, rectal. All other routes bypass the first pass effect because, again, it's not going to go through the digestion process. It's not going to go through the liver. Therefore, it's not going to be affected by the first pass effect. So if we say, we ask you, well, is a aspirin PO going to be affected by first pass effect? Yes, right? Because it has to go through the GI tract, it has to be digested, the liver has to metabolize it, and then the patient will then have the effect of the drug. On the other hand, injectables, right? If you administer something IM, that's not gonna be affected by the first pass effect, right? Because again, it doesn't need to be digested. It can basically just almost instantly, not as fast as IV, but it's gonna bypass that first pass effect, right? Because it's gonna go almost directly to the bloodstream. Similarly, if you have a sublingual medication, that's not gonna be affected by the first pass effect. And some of you may wonder, well, you're still putting it in your mouth, right? Yes, but you're not gonna be swallowing it. That drug, sublingual drugs, are actually gonna absorb within the vessels in that area. It doesn't need to be digested to have their effect. Process of medication administration. Make sure that when you're giving the medication, you need to be as punctual as possible. We do understand that, things happen, and sometimes, you have so many patients, but you have to really manage your time appropriately, because you don't want to give a drug 2 hours late, right? Usually most places, most hospitals and facilities will allow you to give the medication within 30 minutes to 60 minutes of their time, their due time. So obtain the drugs for one patient at a time. Please don't take all the medications for all your patients, because what happens is you may end up mixing them together and giving the wrong drug to the wrong patient. Always observe the 3 checks again, and also check the pharmacy and make sure that they verify the medication, especially when in doubt. Always check the expiration date. You don't want to give expired medication to your patients, and ensure that they're compatible, especially if you're needing to mix certain medications. You don't want to mix medications that are not compatible, because one, they may lose their effect, or two, it may cause an adverse effect on the patient. Always ensure as much as possible to open the medication at the bedside. You don't want to open a medication, especially when you open it and you don't label it, and then you get to the patient room, you can't even remember which medication was which, right? So try your best to open the medication at the bedside. That said, we are also aware that in some facilities there are multi-dose, multi-patient vials that patients share, or maybe the patient has it for themselves, but then it's a 30-day supply type of thing. So we understand when it's not possible, but if it's at all possible, make sure you're opening them at the bedside. It just prevents more errors from happening. And if the patient refuses the medication, try your best to educate the patient, because most of the time they refuse because they don't understand the benefits of taking the medication, or the potential consequences of not taking the medication. If they're still refusing, make sure that to return the medication if you haven't opened it yet. If it's open, obviously, make sure you discard it, and document the refusal, and make sure that you're also notifying the provider. Sometimes notifying the provider will basically have, hopefully the provider will go and talk to the patient. They may end up convincing the patient, or they may come up with another alternative, and then maybe that patient's going to be more compliant if they change the medication. And whenever you're giving the medication, do not immediately leave the patient after medication administration. One, you want to make sure that they actually swallow their medication. Especially, like some patients will say, I just leave it at on my table. No, don't do that, because what happens, they may forget about it, or they may throw it away, or somebody else may end up taking it, right? And so you want to make sure that before you leave the room, that the patient has already taken the medication. And if you can, especially if it's their first time taking that medication, I suggest that you stay with the patient for the first 15 minutes after they take that medication, because you want to be there in case they experience any adverse reactions from that new medication. And always go back and evaluate your patient. Again, that's part of your duty as a nurse. It's not enough to just give the medication and go. Always go back and make sure that they're experiencing the effects that you were expecting, and hopefully they are not experiencing adverse effects. And if they are, if you go back, then at least you're going to be able to intervene and do something about it, right? When you're administering medications, make sure that you always observe the 8 rights of medication administration, and please don't forget hand hygiene, right? So most places you have a hand sanitizer by the door, so please gel in, gel out, right? Check the order and check the chart, verify, make sure that you're following the 8 rights, examine your patients. Let's say you assess your patient at 7 and you're giving the medication at 10. Guess what you're going to do again before you give that medication? You look at your patient again. You evaluate your patient to make sure it is appropriate for your patient, especially if you're, let's say, giving a blood pressure medication. You don't want to give a medication blindly. So if it's a medication for their blood pressure, you have to check their blood pressure before you give it to the patient, because you want to make sure that that's appropriate for your patient. Make sure that you let your patients know that you're going to give them their medication. Kind of plan ahead and plant a seed whenever you leave. Let's say you went to your patient room at 8 o'clock and you know you're going to go back in an hour. Just kind of give them a heads up. Hey, I'm going to be back in an hour to give you your medications. Look up the medication and do your med math, and obtain all your supplies before you give the medication.
one thing that you don't want to do is you're in the patient room and you keep on forgetting something, right? So make sure you gather all your supplies. If you have to make a checklist to make sure that you have everything, please do so. That will save you a lot of time, and it really will help the patient too, because the last thing you want, they're ready to take their medication and you're in and out of the room forgetting something. And then make sure that you pull the medication and verify if it's the right medication. When you return to the patient room, always knock, be polite, explain what you're doing, let them know what you're giving. Check the patient identifiers. So 2 identifiers, check for allergies as well. Educate your patient about the medications. Again, the drug name, the purpose, the side effect, those are the minimums. And really answer any questions that they may have. And if there's any additional information that you need to add regarding the medication, example, if the medication can cause them to feel dizzy, then maybe you want to give them a heads up, right? Be careful when you're standing up because this medication may cause some dizziness, right? You don't want any surprises for your patient, and you want them to be safe. Always scan the medication if the technology is available. So scan the medication, and when you prepare and open the medication, ideally you want to do it at the bedside if you can. If not, then you have to do what you have to do. And again, at that moment in time, you also check and verify again, make sure it's still the right medication, the right patient, and so on. And then right before you administer the medication, check again. Then administer the medication. After administering the medication, always document, and then go back to the patient room and evaluate for effects, side effects, and adverse reaction. And really ask yourself, did the patient have a right response for this medication?